Hello and welcome to this pre-recorded feedback event for the June 2015 examination for Unit 1, Human Lifespan Development. Here are the aims and objectives of today's session. Delegates will receive feedback on performance of learners of the June examination series. Consider questions where significant numbers of learners underperformed and possible reasons why. Discuss the lead examiner's report. Consider delivery strategies and share good practice. Address common issues. Find out about further support available. Resources to support this session. Delegates are now asked to pause to read the lead examiner's report. Please note that the majority of the questions on the paper have been commented on in the lead examiner's report. This is another resource to use to help understand the requirements of each question, and to see what sort of responses were given by candidates and how they were awarded marks. Some of the information from it has been used in this presentation. The report can be given to learners, so they can see for themselves what is required for the different types of questions, and how they can be awarded marks. Delegates are now going to be introduced to the assessment. Please open the Unit 1 specification document. As can be seen, the unit is split into two learning aims. The June 2015 paper addressed Learning Aim A and B. The questions within the paper were spread across Level 1 and Level 2, Pass, Merit and Distinction. The next 5 slides will look at questions where learners did well. Question 1E, Part 1. Learners had to give examples of how Margaret's family could support her. The majority of learners did well on this question. Popular responses included taking Margaret to the day centre and inviting her round to their home for a meal. Question 1E, Part 2. This question is a straightforward multiple choice. Learners need to identify their chosen responses. Most learners achieve 2 marks. Question 2A. Learners needed to identify 2 expected life events to achieve 2 marks. Learners tended to do well on this question and were able to achieve both available marks. Question 2C, Part 3. Learners were required to explain how Dana's disability could impact on Roshan's social life. The majority of learners answered this question accurately. Staying in to look after Dana instead of going out with friends was the most popular response. Question 2D, Part 1. Learners had to identify one negative effect of Imran's imprisonment on Bella's emotional development. The majority of learners did well on this question. Responses included low self-esteem and depression or sadness. Why learners did well. Learners tended to perform well in the earlier level pass questions, as these tended to be more accessible to a wider range of learners. Most learners showed an understanding of lifespan development. and were able to investigate the factors that affect human growth and development and how they are related. The use of previous papers and mark schemes during lessons will support learners in preparation for the external assessment. The next 4 slides show examples of why learners accessed less marks on certain questions. Question 1D, Part 1. Learners were very confused about the term lifestyle choice. Responses often referred to getting married or having children rather than exercise, diet, drugs, or alcohol. Question 1D, Part 2. Learners who were unable to respond correctly to the previous question on lifestyle choice frequently missed marks here as well. Incorrect responses included going to university and job choice. Question 2C, Part 1. This question was challenging for many learners. There appeared to be some confusion with the term inherited. Incorrect responses included diabetes and dementia. Question 2E. This question was poorly answered by many learners. Common mistakes included addressing all pies rather than just the physical effects. Many learners incorrectly wrote about the impact on Bella's baby as it grows up. Moving on, delegates will now have an opportunity to attempt 3 of the questions from the June 2015 paper. Activity 1. This is a learner's response to question 2B. Pause the recording and look at the example. Using the mark scheme, decide what mark should be awarded and why. This is the learner's response to question 2B with an explanation of how the marks were awarded. Full marks were awarded for this response. 1 mark for passed her degree. Further mark for elaboration, make her feel successful. 1 mark for first job. Further mark for making her feel happy. On this question, successful learners used specific reasons, used accurate vocational language, demonstrated their understanding of self-esteem. Activity 2. This is a learner's response to question 2D, Part 2. Pause the recording and look at the example. Using the mark scheme, decide what mark should be awarded and why. This is the learner's response to question 2D, Part 2, with an explanation of how the marks were awarded. Full marks were awarded for this response. 1 mark for increased confidence, 1 mark for child to look after in the future, 1 mark for feeling independent and responsible, 1 mark for chance to be a mother or role model. Why learners did well in this question? Used accurate vocational language. Demonstrated their understanding of emotional development. Were able to explain the responses fully. Activity 3. This is a learner's response to question 1F, part 3. Pause the recording and look at the example. Using the mark scheme, decide what mark should be awarded and why. This is the learner's response to question 1F, part 3, with an explanation of how the marks were awarded. 6 marks awarded. 1 mark for Margaret feeling proud. 2 marks for David may take Margaret out more often because he is able to pay for her. 2 marks for David won't need or want Margaret's help. 1 mark for David will have less time for Margaret. Why learners did well in this question: demonstrated their understanding of social and emotional development, were able to explain their responses fully, used accurate vocational language, included positive and negative effects. Common issues during this examination series were learners not making use of the scenario within answers. Centres could make more use of practice papers or write their own questions. Learners not reading the questions fully. Centres could make more use of practice papers or write their own questions. Many learners managed their time ineffectively. Centres could use timed assessment in the classroom to give learners some practice at managing their time. Please note that this part of the presentation is dealing with the delivery of the qualification, rather than the exam. Delegates should now consider delivery strategies and best practice. 1. Practical-based learning sessions, using role play, for example. 2. Mapping or integrating units across the centre. Although this can be an arduous task, it is proven to be beneficial in many centres. 3. Scenarios or contexts. Use these so learners get an idea of the different vocational scenarios. 4. Use of delivery guide. It is a useful document, but concentrate on each section of the specification. Use learner experience where possible and appropriate. 5. Group work. Learners can help each other understand topics. 6. Research. Look at the how and why, rather than just using. 7. Projects. 8. Exam techniques. Use this presentation and the lead examiner report to explain to learners the different exam techniques, especially where they might not be obvious when looking at a question, such as explain, 1 mark for identification, 2nd mark for justification or expansion. 9. Enter learners when they are fully prepared, so they will be able to achieve the best mark possible. This slide includes detail of where further support is available. This is the key web page for customers to be aware of for support and guidance with BTEC results. For further guidance and support with the delivery and assessment of BTEC, see our full training offer here: www.btec.co.uk/training. Hyperlinks to the documents required for this presentation. For further guidance and support with the delivery and assessment of BTEC, see our full training offer here. www.btec.co.uk/training. Any further questions to be directed to the Subject Advisor for Health and Social Care, Kate Elsmore.